everybody, Dr. John here. I just want to take a minute to address a difficult thing that we have in healthcare. And what that means is all healthcare practitioners, if you ask them what is the most difficult thing in trying to help someone, they're going to say compliance. And for us, our compliance isn't necessarily a difficult thing in our adjustment schedules. That's easy. We have procedure to help you with that, with pre-booking your appointments, and at the same time and all that. What our compliance difficulty is making sure that our patients are doing the home rehab part, the home exercise part that we give them to help sustain and hold their adjustments better between the adjustments. So I can tell you, I've literally in the past 16 or 17 years probably have given thousands of people different types of exercises based on, say, initial exam and x-ray finding, something to help them with their care in the office to do at home. And so when you ask a person if they want to get well, they're always going to say yes. And if you further ask that person if there was things you could do specifically for you based on our exam that you could do outside the office to help yourself get better faster, stay healthier longer, and to make your results that much better, would you do it? And again, everybody always says yes. But what I can say is this, is the people that say they're going to do it and actually do it versus the people that say they're going to do it and maybe not perfect, and I'm right up there with you, we're not perfect at everything, but there's a few things that make the people that actually do it, make them more successful. So I want to just talk about what makes them more successful and why they're able to do that more consistently. So they're easy. What I found is the first and most important thing is making sure that you're doing the exercises that we've given you at the same time every day. And it doesn't matter. I don't think it matters what time of day. It doesn't make you more successful if you do it in the morning or afternoon or after lunch. What makes you successful, it's easier to form a habit. So, for example, for me, I'll typically do my spinal rehab hygiene when I do other hygiene things like brush my teeth or floss. So if you keep it consistent like that, it just gets added to that, and it takes you minutes, literally. So it's not like it's going to take you a long time. So that's one tip. Another tip would be if you have equipment, for example, if we've given you a DEN roll, a lumbar traction wedge, or a Scully roll, a TheraBand, a TheraBall, keep that equipment in the same spot. Don't move around your house thinking it's better here, better there. Just keep it in the same spot. We found that when it's in the same spot, you know where it is. You've already formed the habit of time, so just keep it in the same spot. One thing I will say, if something that we've given you can fit on top of your desk at home where you do all your work, don't put it there. It's going to get buried. If it's like anything like my desk, it'll be buried in papers and pictures and drawings my kids have done. It'll be lost. So that will be one way to be unsuccessful at doing it if you put it on your desk. Another thing is making sure that you have some way to mark or check off that you've done it. So with some units, we actually give in our office a piece of paper that you can check off and write the date. That's very effective. For me personally, I like putting it right into my Outlook calendar. So if I know it's going to take me 10 minutes or 15 minutes at 6:30 to 6:45 a.m., I'll put it in there, hit repeat, I get a reminder. So just making sure you have some way of marking it or reminding is a very effective strategy as well. Another one that we've all heard of that we don't typically use enough of is having an accountability partner. Do you have a child, a friend, a spouse that you can book this with to do? And they could do some stuff too that could help them. Another patient will say that it's the best time they have with playing with their dog, because as soon as they get down on the ground to lie on a traction wedge, their dog comes and plays with them. That is okay as long as you're not moving rapidly to injure yourself. Whatever it takes from an accountability perspective, put that in your life and it'll help you. And the last one we'll discuss in those people that have been successful at doing their rehab consistently is probably looking at your motivation. What is your motivation? For me as a healthcare practitioner, everybody's motivation is a little bit different. So, your motivation might be to get out of pain. So use that as your motivation. Another person's motivation might be like, I want to be able to bend over and pick my kids up out of their crib without not being able to get up. So that might be your motivation. I know a grandparent might say, I need to be able to babysit my grandkids for 6 hours at a time. Someone else might say, I need to be able to swing my club and hit a perfectly smooth, straight shot. It doesn't matter what your motivation is, but the motivation will be there during the times that you don't want to do it, and you think about, why am I doing this? It's to give myself the best chance for the best quality of life, not only now, but in the future. So, people come and we give them recommendations for an adjustment schedule and their rehab, and these things are specifically put together for you individually based on your tests, your health goals, and at the end of the day, it's all about your quality of life. So those are some tips that will help you be more successful in being consistent with some of the things you need to do outside the office to support what we're doing on the inside the office. Hope this helps to better health in 2020. Until next time, be well.